my name is Katie, and I'm a nurse practitioner student with NKU, and I will be conducting your physical exam today. I'm going to start by washing my hands first. And can you tell me your name and date of birth, please?
Chad Clevenger, April 19th, 1989.
Perfect. And do you know what today's date is?
December 3rd, 2019.
Perfect. And do you know where you are today and why you are here today?
I'm in an NKU exam room for my physical examination.
Perfect. And do you know who the current president is of the United States?
Donald Trump.
Awesome. So he is alert and oriented. He knows where he is and why he is here. He appears well nourished. We're going to start by getting your vitals. So we're going to get your temperature first. And place this under your tongue. And while that is reading, I'm going to get your pulse and your respirations. So his pulse is 80, which is normal, and respirations are 14. Okay, let me see that. And temperature is 98.6, which is normal. We're going to get your blood pressure. Perfect. And just relax your arm this way. There you go. Great. 118/80. That's normal. And we already collected his medication history, past medical history, and allergies prior to beginning this exam. We already got his height and weight. He is 5'9". He weighs 210 pounds. His BMI is 31.01, which puts him in the obese category. And we already discussed some lifestyle choices that he could make. And he stated that he'd be working on some of those, which is great. We're going to start by inspecting your head. So his face is symmetrical. His head is an appropriate shape and size. It's normal cephalic. Next, I'm going to palpate your head for any bumps, lumps, lesions, or infestations. And let me know if you have any pain or tenderness. And I don't see anything. And his scalp is pink and healthy. Next, I'm going to palpate your sinuses. Let me know if you have any pain or tenderness. Okay. Perfect. And can you blink your eyes for me and then open? Perfect. Can you smile for me? Awesome. And then frown? Great. Then can you bring your chin to your chest and then look up for me? Awesome. Then I'm going to place my hand against your head, and I want you to push against my hand. Perfect. Push against my hand on the other side. Wonderful. Then can you bring your ear to one shoulder? And bring the ear to the other shoulder. Great. And we're just testing your range of motion. Next, I'm going to inspect your eyes. And do you wear glasses or contacts?
No.
No. Great. I want you to cover your right eye for me and read to the lowest line that you can read.
LTFPH.
Perfect. Cover the other eye and read to the lowest line you can read.
LTFPH.
Great. So you're seeing 20/20 out of both eyes, which is normal. That looks great. Next, I'm going to shine a pen light in your eyes to test your pupillary reflex. Great. His sclera is white, his conjunctiva is pink and moist, and his pupils are equal and reactive to light. We're going to do the 6 cardinal positions of gaze next. I want you to follow the pen light with your eyes only, keeping your head still. Very good. Awesome. And then follow the pen light to your nose, keeping your head still, just your eyes. Perfect. And I'm going to look in your eyes next. And I can see his retinal reflection. Put this back over here. And I'm going to inspect your ears next. So I'm looking for any lumps or lesions or any abnormalities. And next, I'm going to palpate your ears for any lumps or lesions. And are you having any problems with hearing or any discharge?
No.
Okay, great. And next, I'm going to look in your ears. I'm just changing my piece out here. Okay. And his ears are clear and the eardrum is intact. Next, I want you to cover one ear, and I'm going to whisper a word on the other side, and I want you to tell me if you can hear the word that I whisper.
Apple.
Perfect. And cover the other ear. I'm going to whisper a word, and I want you to tell me if you can hear that word.
Baseball.
Perfect. Next, we're going to do a test for conductive hearing loss. I'm going to place this tuning fork on each side. You're going to have sound 1 and a sound 2. And I want you to tell me if you can hear sound 1 louder or sound 2. So this is 1 and this is 2.
1.
Perfect. And we're going to do the other side. So we have 1 and 2.
1.
Perfect. And then I'm going to place in the middle of your head. I want you to tell me if you can hear it greater on the right or greater on the left or equal on both sides.
Equal on both.
Perfect. Very good. Next, I'm going to inspect your nose. Are you having any problems with bloody noses or discharge?
No.
No. So his nose is symmetrical. I don't see any broken vessels from the outside. Next, I'm going to palpate your nose. Let me know if there's any pain or any tenderness. Okay. And I'm going to look in your nose next. Okay. Grab another one. Perfect. So I don't see any polyps or any discharge. Looks good. Next, we're going to do a smell test. So I want you to close your eyes for me and cover one nostril. And I'm going to place something in front of your nostril and tell me what you smell.
Vanilla.
Perfect. And keep your eyes closed, cover the other nostril, and then tell me what you smell.
Garlic.
Perfect. Next, I'm going to inspect your mouth. I'm just going to get some gloves on over here. Are you having any problems with chewing or swallowing?
No.
Okay. And any missing teeth or any problems with your teeth?
No.
Okay. Perfect. Can you open your mouth for me, stick your tongue out and say ah?
Ah.
Perfect. So his uvula is midline. His soft palate rises when he says ah. I'm going to inspect your cheeks now. His buccal mucosa is pink and moist. Can you lift your tongue up and over to the side? And we like to look underneath your tongue because that's where a lot of oral cancers can start. And everything looks good and healthy. Next, I'm going to inspect your neck. So I just see some normal moles, freckles, but nothing that looks abnormal or concerning. I'm going to palpate your neck next. And can you swallow for me? I'm just feeling for your thyroid. Great. Can you swallow again? Great. Then I'm going to take 2 fingers in a circular motion, and I'm going to feel for your glands. Okay. And I don't feel any swelling, which is good. Can you shrug your shoulders for me? Perfect. And then you push your hands against my shoulders. Or I'm sorry, your shoulders against my hands. Perfect. Next, I'm going to palpate for your carotid artery on each side. Great. Perfect. And it's equal, normal on both sides. Next, I'm going to listen for any bruise with the bell of my stethoscope. And can you take a deep breath for me and hold as I place the stethoscope on your neck? Great. Very good. And you can breathe normal and then take a deep breath and hold. Good. So I don't hear any bruise, which is good. Next, I'm going to inspect your skin. Can you place your arms out in front for me? Great. So I just see some normal moles and freckles, but nothing that looks abnormal or concerning. Are you having any pain in any of your joints? No. And I'm just feeling for any swelling or edema, which I don't feel any swelling or edema. So that is good. His skin's warm to touch. The turgor's normal. And I'm going to check your pulses on both sides. Great. And they are 2+ and equal bilaterally. Very good. And then I'm going to check your capillary refill. Great. And that's less than 2 seconds, which is normal. Can you grab both of my fingers on each side as hard as you can? Great. So his grip strength is equal bilaterally. Can you push against my hands? Great. And then I'm going to try and push your hands down. Don't let me push them down. Great. So his strength is equal bilaterally, which is very good. Next, I'm going to inspect your chest. Is it okay if we lift your shirt? Perfect. Are you having any problems with breathing or any shortness of breath?
No.
No. Okay. So I'm inspecting his chest. He just has some moles, freckles, normal hair distribution. His chest is symmetrical. I don't see anything concerning or abnormal. Next, I'm going to palpate your chest. Great. And then I'm going to percuss the chest. Perfect. And then I'm going to listen. I want you to take a deep breath as I place the stethoscope on your chest. So deep breath. Good. And deep breath. Deep breath. Great. So his lungs sound clear. I don't hear any wheezes, crackles, or stridor. Next, I'm going to inspect your back. We're going to listen to the back. Is it okay if we lift your shirt? Great. I just see some normal freckles and moles, but nothing that looks concerning or abnormal. I'm going to palpate your back next. And percuss your back. Then I'm going to place my hands on your back, and I'm going to have you say 99 as I place them down your back.
99, 99, 99, 99.
Perfect. And I'm going to listen to your back. Take a deep breath for me. And deep breath. Great. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Perfect. So his lungs sound clear. No wheezes, crackles, or stridor. Next, I'm going to have you just lean back a little bit at about a 45-degree angle for me. I want you to look over towards the wall for me. And I'm just checking for any jugular venous distension. I can see his pulse, but I don't see any jugular venous distension. And next, I'm going to listen to your heart. All right, so I hear a normal rate and rhythm, S1 and S2 sounds. I don't hear any extra sounds, no S3 or S4, and no murmurs. Next, I'm going to palpate for your apical pulse. And it's at the 5th intercostal space, mid-clavicular line, and I'm going to listen for your apical pulse. And the rate's about 80, and it's a normal rate and rhythm. Very good. Next, I'm going to inspect your abdomen. Is it okay if we lift your shirt again? Great. So his abdomen is symmetrical on both sides, just some moles, freckles, but nothing that looks abnormal. And when was your last bowel movement?
This afternoon.
Okay. Good. I'm going to listen in all 4 quadrants for bowel sounds. Okay. He has active bowel sounds in all 4 quadrants. Next, I'm going to palpate your abdomen for any masses or tenderness. Okay. And I'm going to percuss your abdomen. Very good. Excellent. You can bring your shirt back down. Good. Then I'm going to inspect your legs. I'm going to bring this out here so I can see them better. Okay. So just some normal moles and freckles, but nothing that looks abnormal or concerning. I don't see any viscosities, which is good. And can you raise one leg up for me and then push against my hand? Great. Raise the other leg, push against my hand. Very good. Can you bring one leg out to the side? And then you can bring it back in. Can you bend the knee in towards your chest? Great. Can you bring the other leg to the side? And then bend that knee in towards your chest? Great. Can you lift both legs for me? Awesome. And I'm going to check your capillary refill on your toes, which looks great. It's less than 2 seconds, so that's normal. Very good. And I'm going to feel your dorsal pedis and posterior tibialis pulses on both sides. Great. And they are 2+ bilaterally, normal rate and rhythm. They look great. And you can go on and sit up for me if you'd like. I'm going to have you close your eyes for me. And I want you to tell me if you can feel any light touch on your face.
Yes. Yeah. Yes. 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 Yes.
You're able to feel that? Great.
Yes.
Then we have 2 different sensations. This is going to be dull sensation, and this is sharp. I want you to tell me if you feel dull or sharp.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Perfect. You can open your eyes for a minute, and then I'm going to have 2 objects, and I want you to close your eyes again. I'm going to place one object in your hand. I want you to tell me if you know what that object is.
A coin.
Great. You can put it back. Keep your eyes closed. Place your other hand out. I'm going to place another object in your hand. Tell me what the object is.
Toothpick.
Perfect. And then we're going to test your reflexes. Next, you can open your eyes. Okay. And then relax your arm for me. And relax that tricep. Great. Okay. Relax. Relax. And flex your foot, relax for me. Great. And relax. Okay, relax. And other one. Okay. And flex up, relax. Very good. And next, I want you to stand up for me. Okay. And close your eyes with your feet together. Great. Good balance. And then I want you to bring your arms out in front with your palms up. Great. And I'm just looking for any pronator drift or any drifting of his arms, and they're equal in balance, so that looks normal and good. You can bring your arms at your side. I want you to walk from the door, walking however you would normally walk for me. Great. And then walk back, heel to toe. Wonderful. Very good. And then can you take one foot and slide it down your leg? Great. We're just testing for your balance. Can you do the other one? Very good. And then I want to inspect your back. Can you turn this way for me? Is it okay if we lift your shirt? Okay. And I'm just looking at his back and just some normal freckles and moles, nothing concerning. I'm just feeling and palpating your spine, and curvature feels really normal, straight, and good. I want you to bend over if you can for me. Bend. And I'm just feeling your spine again. His curvature feels normal and feels straight. So that's great. You can stand up for me. And this concludes our exam. And if this had been a regular clinical exam, we would have also examined his genitals and done a digital rectal exam as well.